Most doctors stop at behavioral therapy when it comes to autism. But what if there's more? What if the meltdowns, regressions, and speech delays have treatable medical roots that are just being completely overlooked? Our guest today, Dr. Richard Frye, is a nationally recognized leader in autism research, and he's one of the few physicians asking the deeper questions and finding answers. For over 20 years, he's been leading clinical studies to better understand the biological and metabolic factors driving autism spectrum disorder. He's a board-certified pediatric neurologist with additional expertise in neurodevelopmental and neurometabolic disorders. He holds both an MD and PhD in physiology and biophysics from Georgetown University and completed his training at some of the top institutions in the world: pediatrics at the University of Miami, child neurology and behavioral neurology at Harvard Children's Hospital Boston, and a fellowship in psychology at Boston University, with over 300 peer-reviewed publications and book chapters. His groundbreaking clinical trials, like the one that led to that now viral video of a nonverbal child speaking after using Leukovorin, is completely changing lives. So today, we're going to go deeper and ask, what can parents do to help their kids, and is it too late? All right, Dr. Frye, thank you so much for being here. I just want to first say thank you for everything you do to help children and families. Your work just brings so much hope to so many of us, and I firsthand, as an autism mom, have experienced some of the amazing outcomes from treatments that you've led research on. So I'm so excited to talk to you today about everything that you're doing.
Yeah, thank you so much for inviting me. It's really great. We can get the word out of, how to make kids better.
Definitely. Well, let's just start with the big first question around leucovorin. I was shocked to find out that so many parents knew nothing about this as a treatment option for speech and language specifically, which is probably one of the number one goals most parents have, is to have communication with their kids. So can you explain a little bit about what leucovorin is, and how it works, and some of the responses you've seen your patients have from using it?
Sure. Yeah. And as I mentioned, we've been doing this for a long time. We're glad that the word is getting out. Really, it's an interesting story, I would say. But, I would say that in some ways, we kind of happened upon finding this right after it was discovered. So in about five, there was a very well-known paper in the New England Journal of Medicine, which is one of the best journals there is, on something called cerebral folate deficiency, and it described these kiddos that weren't developing, very well, and some of them had actually lost skills, usually before 1 year of age. And there was a doctor by the name of Dr. Rainmakers, who's in Belgium, and he had discovered that when he did a lumbar puncture or spinal tap, as we call it, to figure out what was going on with these kiddos, he found that there was low folate in their cerebral spinal fluid. And this is not something that we routinely tested for back then, or right now, actually. A lot of people don't, but it's much easier now. But he was collaborating with Dr. Blau, who's probably the world's expert on the neurochemistry of the brain. And he didn't know why this was, that there was low folate. And folate, as you might know, is extremely important. When you're pregnant, you're supposed to take folate because the child needs it, the fetus needs it to grow. But it's so important to almost every other system in our body. And so if you don't have folate, one, your body's not going to work, and it's not going to be able to grow either. And there's many other issues. What happened is that if you looked at some of the literature and some of the other reports when they discovered this, a lot of the kids seemed like they had symptoms of autism. And they hadn't made that a big deal about that in the beginning. But I had been working at University of Texas, Houston, and when kids did not develop and we couldn't figure it out, we took it seriously, and we do sometimes lumbar punctures also to see if there was something wrong with their biochemistry in their brain. And we started discovering that many kids with autism had this low folate. Now, the thing about this is that we can treat it. We can treat it with something called leucovorin. So the way that it works, just to back up for a second, is that, as I had mentioned, Dr. Rainmakers didn't know why the folate wasn't getting into the brain. And we know that there's this one special carrier called the folate receptor alpha. So we have to understand that the brain itself is a protected area of the body. So everything that goes in there is very well regulated. And so things have to be brought in and brought out by little machines, little transporters, and sometimes they don't work. So he figured out that the folate receptor alpha, the main transporter that transports folate into the brain, wasn't working. And he didn't know why. And of course, he thought it was a genetic disorder at first. So he sequenced the gene in these patients and he didn't find any problems. So the interesting story is that Dr. Quatros, who is at SUNY Downstate in Brooklyn, had been working on folate, but from the side of prenatal care, folate, trying to prevent what we call neurotube defects, which happen if you don't have enough folate during pregnancy. And he had discovered that there was a antibody that bound to this transporter, this folate receptor alpha transporter. Now, an antibody, as you might know, is something that's in your blood. It's made by your immune system, usually to bind to bacteria and viruses so they can be taken out of the body. But some people have antibodies that sometimes they make antibodies to themselves, to their own body. And this seems to be one of those cases where this antibody is attacking your own body by binding to the specific protein called the folate receptor alpha. Now, the good thing is that we have a backup system. Okay, there's another transporter called the reduced folate carrier that can get folate into the brain. But it's a little bit different than the folate receptor alpha because the concentration of folate in your brain is 2 to 3 times higher than it is in the blood. That's how important it is to the brain. It has more folate that's in the blood.
Mhm.
So the folate receptor alpha, this transporter, actually pulls folate from the blood into the brain. It takes a lot of effort to do this. Well, this backup carrier doesn't do that. It's just kind of a passive tube, let's say, to get into the brain. So you have to use a special type of folate at high doses to essentially push folate into the brain. And that's where we use this special type of folate that's a prescription folate called leucovorin. So essentially, the folate receptor alpha is like a giant fire hose, and the reduced folate carrier is like a little straw. So we got to push it through that straw. And what was found in early on in some of the cases of cerebral folate deficiency is if you used leucovorin at high doses, its symptoms improved and sometimes completely went away. So very, very promising. So I was very excited that we found, treatment for some of the kiddos with autism. But the question was, how many children are out there? So yeah, so I had been working with Dan Rosignol, and we were mostly working on review papers, looking at the literature and stuff. But we said, wow, we can measure this folate receptor alpha antibody. This is called a biomarker, something that will tell us there's something wrong. Why don't we see how many kids in our autism clinic might have this? And that was our first study. And we found out that 75% of kids with autism have one of the two antibodies. It's a blocking and a binding antibody, and that about 75% of the kids have one of those too.
Yeah.
So that's a big number.
Yeah, my son tested positive on his frat test that you're talking about. So I think that's probably one of the reasons why we've seen a lot of success in using Leukovorin. But that's so interesting. That brings up a follow-up question I have. So should we be testing more kids for folate receptor antibodies earlier on? And the reason I ask that is because my son was addicted to cow's milk. And I know casein you should eliminate from the diet. So I'm just wondering if, had I had known a lot earlier, could I have prevented the outcome, I guess.
Right. I mean, of course, the answer is we don't know. You just do what you do, what's best at the moment, right? And then we always learn things. So yeah, one of the things that we do know is that cow's milk seems to increase the titer of the antibody. But I will say a lot of the kids that we measured in our first study were on milk-free diets and they still had the antibody.
Wow.
So it's not just milk, but the cow's milk at least definitely has a lot of reasons. It's very inflammatory, to our guts when we're not a baby anymore. So our body changes. So when we're an infant, we can tolerate milk very well. But as you know, everybody's lactose intolerant, right? There's an $11 billion industry on making not milk milks. And
Yeah.
there's reasons for that. Our body's not designed to drink milk after a certain point. and it can cause inflammation and cause GI disturbances, as you know, if you drink too much. So, yeah, I mean, that's one factor we see after a certain point, cow's milk may not be that good to drink, but there's probably other reasons why this antibody is there. Is it there before time? Well, some of the new research we're working on suggests that it actually runs in families, that if the child has it, the parents, the siblings may also have it too.
Wow, that's interesting.
Yeah, so some kids have a double whammy because, as I mentioned, Dr. Quatros was working on prenatal, folate transport. And those same transport mechanisms that are on the brain are also on the placenta. So if the mother has the antibody, there may be problems getting folate to the fetus, and then they may have the antibody afterwards, and then actually they may be affected again. So it's a complicated matter. And that brings us to the very important point of what is folic acid. So it's amazing that vitamins are so complicated. People think that they're so simple. But folic acid, which we have in most of our vitamins and which our food is supplemented with, is the synthetic form of folate. So it's not in nature,
Hmm.
but it's more stable. It's less expensive, so we can fortify our foods with it. It could last a long time. So there's positives to it. But what we're learning is that our bodies have to activate it. And some of us are not good at activating it. And even those that are, at activating it, there's a limit to how much we can activate. So at a certain point, you can't just give more folic acid to help with folate metabolism because it's just what we call unmetabolized folic acid will build up in our body. And we're finding out that's not so good. So it's one of these things where a little bit might be good, but a lot, for some reasons, may not be. So that's compared to what we call more of the bioactive folates. So the bioactive folates are things like 5-methyl tetrahydrofolate, leucovorin, which we use, tetrahydrofolate. These are all bioactive. They go right into the folate cycle in our body. They don't have to be activated. And it ends up, it seems like you can give as much as you want and they don't cause any negative consequences. Of course, folate is a B vitamin, vitamin B9. What we like about B vitamins is that they're water soluble. Now, what that means is you pee them out if you have too much. So your body has a safety mechanism for B vitamins. So they can't really become toxic because you're going to pee out the extra.
Interesting. Just a follow-up question I have about I get a lot of questions from parents too around family planning and them being scared if they already have one child with autism. But if their child with autism also has cerebral folate deficiency, is there anything that they should do differently now that they know that?
Right. So probably yes. So everybody, all parents that want to have more children, there's certain guidelines and certain workup that we offer. First of all, personally, for all my patients, I do genetic testing to find out if there's a genetic basis, see if there's something in the family they have to worry about. That's one thing. But we also find out that many of these things, the folate receptor antibody, also mitochondrial issues, oxidative stress, and such, have all been identified in mothers of children with autism. So we essentially do almost the same workup on the mom as we do on the child and treat appropriately. So it's suggested to take reduced folates rather than folic acid for mothers that have the folate autoantibody. So, you could treat with leucovorin. How much? We really don't know. So that's something we really have to find out. And hopefully we'll do studies in the future. But really, the mom should take, and anybody that's thinking of having a child should think of using one of the vitamins that have reduced bioactive folates in it rather than folic acid. And they should start way before they're planning to become pregnant. Because when you're pregnant, it depletes your body of all your resources. So you want to build up those resources before time.
Yeah, that's super important.
It can also so there's a foundation called the Neurologic Health Foundation
Okay.
that has what we call the Healthy Child Guide. So we've put that together. I'm the chief medical officer, but Dr. Jim Adams is a chief scientific officer for it. It's kind of one of his babies. He really put a lot of work into this, and we've put together a guide, and we've have probably about 20 or 30 practitioners in there, each that have helped us put the guide together. It's all based on science about what you can do to have a healthy pregnancy. And if you go to the website, there's lots of videos too that talk about all the different aspects of this. There's many simple things you can do to make sure that your pregnancy is healthy and that you have a healthy child. It's not easy. There's a lot of stuff, but I would encourage everybody to go there and try and follow some of those rules and talk to your doctor about how to have a healthy pregnancy.
That's incredible information. Thank you for sharing that. That'll be so useful to so many moms.
Sure.
I know part of your research too is around mitochondrial dysfunction, and that may be present in a significant amount of children with autism. What should parents know about that?
Yeah, that seems to be something else that is very prevalent in kids with autism. There's all types of reasons for the mitochondrial not to work well. And of course, it's not autism, it's becoming very popular, the mitochondria in health and such. And that's because your mitochondria is very sensitive to every type of environmental influence. So, not only things like toxins, but also your diet, stress and such. And if your body is under stress, your mitochondria is not going to work very well. Your mitochondria is the powerhouse of the cell. So it makes all your energy. And your brain, in particular, needs a lot of energy. So, for example, the mitochondria is why you breathe. You use oxygen to make that energy. Your brain is only 2% of your body weight, but it uses up 20% of the oxygen that you breathe. That's how metabolically active it is. So that's the first thing when your mitochondria isn't working very well. That's what you're going to see. Your brain becomes foggy, you forget things, and you can become tired. So these are all signs of mitochondrial issues. It could be other issues too, but so we want to make sure that the mitochondria is working the best that it can. What we find is that the mitochondria is part of other systems that aren't working in kiddos with autism. So we see this kind of trifecta of the mitochondria not working, having oxidative stress. That is, that there's kind of toxic radicals in your body, molecular radicals. These are chemicals that aren't controlled. Usually they're controlled, but for some reason the body can't do that. And then inflammation. So all these things play on each other to make the situation worse. So that's why we look for those when we try to treat children with autism. So it's really important to understand that and to make sure that we reduce all of those things because they make each other things worse and then make the body work suboptimal. And a child with disabilities needs their body to work as optimal as possible for them to recover. And that's the one important thing you talk about language, how important language is. And that's one of the things that we really, are excited that Leukovorin can help with language because so many children that lack language can't go forward because of that, because it's hard to communicate. So even if they can communicate with a device or spelling, it's much harder than if they had language to use. And it's very frustrating for them, right? If they can't tell you what they want, can't communicate, it becomes very frustrating. It comes out in behaviors. They can't learn as fast. So having language is really so important.
So important. And I know it's heartbreaking too to see how much sometimes he struggles just to tell the basic things that he needs. So we do anything we can to help him with that. I have another question. I know you mentioned oxidative stress. What other types of environmental triggers or exposures do you think are being overlooked that are affecting our kids?
Well, I think that, yeah, there are some big things. First of all, we are exposed to so many things in our environment. So I always recommend that people get a water filter and air filter for their house, especially in the bedroom. That's where you spend the majority of your time because, yeah, our bodies have been being bombarded all the time with this. But then there's also a lot of medications. So we know about the overuse of antibiotics. One of the things that does is it weakens something called the microbiome, which are those trillions of little bacteria that live in our guts. And those are very, very important. And if they become imbalanced, they can cause inflammation also and disturb the way our body works. So, we're kind of cavalier about using antibiotics, but we see that many kids with autism have this history of having recurrent antibiotic use because of recurrent infections. And many times that will disturb the microbiome, and that will disturb the way the body works and disturb how healthy the body is. Other things, probably like acetaminophen, so Tylenol, it depletes the most important antioxidant in your body called glutathione. That's how it becomes toxic. Um, and um, and so if you're already at an imbalance where you're not making a lot of glutathione, which is a common theme in children with autism, something like Tylenol can push you over the edge. You know, it may be good for some people, but for children whose bodies really haven't developed all these systems well, or for other reasons, they're not working well. Tylenol can make things worse, and it's too bad because every single medication we have, every cold medication has Tylenol in it because we think it's so safe. And it's one of those things where maybe a little bit is good, but when you put it in everything, it may not be good to have too much of it.
Wow, that's just crazy because I feel like pediatricians, regular pediatricians, just recommend that all the time without really understanding or knowing the implications of that. So frustrating.
And it's like any medication, I mean, a little bit may be good, but too much.
Correct. Exactly. I have a question for parents with kids who are a little bit older. They're 7 or 10 or in their teens. I know research is changing and there's so many new things coming out. Is it too late for them to start any of these treatments
Never,
like Leukovorin?
absolutely never.
That's amazing.
I've treated children. I see children, adults, adolescents, and it's never too late. And the other thing is we have new treatments that are always being developed, hopefully sooner than later, which can help, older individuals with autism. So I think there's always options.
So good to hear because I know some parents start to lose hope, but can never lose hope for the future. Let's see. So I also know that there's a lot of people who are resistant to some of these biomedical type treatments. And I don't know if it's more them just not having the knowledge or doing research themselves or them thinking there's a lack of evidence, but I know you have so many papers you've written and you're at the forefront of all the research. What would you say to parents that are skeptical about some of this?
Yeah, I mean, it's always good to be skeptical. That's why, medicine moves slowly. Medicine always moves slowly because we don't want to do any harm. We don't want to, do any harm. So, it's good to be skeptical and do the research, but you can do the research and find the research papers. We try and highlight all the treatments that are safe and effective. Myself and Dr. Rosniel, many times, almost, every year, we're publishing some type of review, to show what the evidence is, because there's definitely evidence for many different things. Now, they don't work for everybody, and you want to make sure you go to somebody that understands how to use them. Even Leukovorin, which is extremely safe because it's a folate, there's sort of nuances to using it and prescribing it. That's always important. So I would say, it's important to really do your research. And, it's interesting because I have been seeing more and more patients that don't know anything about the world of biomedical treatments, and they're coming in because they've heard that it can help and are really changing the lives of their children. So I think it's important, everybody has their own
Yeah,
opinions, and then there's the data.
exactly.
What we've always done is we've followed the data, not the biases. And it's brought us to a place where we've published many papers showing that there's a number of different treatments that are helpful. And children are complex. As you say, some kids don't respond, to certain treatments. But as you know, but we have to say it's not a sprint, it's a marathon. And I've had patients coming in looking for the autism pill. There's no autism pill. It's hard work, unfortunately. Every child is different, but the best thing to do is to, step forward and try things that may be helpful. And if they're not helpful, you can always stop. Make sure they're safe, but there's an interesting study. I always like the study by Dr. Black, who was a study done about 15 years ago. He was at NIH and he said, I'm going to figure out what helps kids recover from autism. Says, all I have to do is study the kids that recovered and I'll
Hmm.
find out what's the common denominator, right? What's made them. And do you know what he found?
What?
He found out that the kids that recovered, their parents did everything.
Really?
Yeah, so they did the diet, they did the therapy, they did the supplements, they did education, they did everything to make sure that their child got to where they needed to be. And the fact is, it's just not one thing. There is no autism pill. It's many things working together. So, we really have to look at every possibility.
I definitely agree with that. That's really hopeful because I'm the type of parent that's like, I will do anything to help my kid thrive. So I really, really appreciate your time speaking with me today, Dr.
Sure.
Frye. Is there anything else that you want to leave parents with? I know I asked you quite a bit of hard questions. And also, can you please tell parents how they can work with you as well?
Sure. First of all, there's always something. So I think that, you have to, it's very difficult, and it takes a lot of effort, but you have to never give up hope and to keep trying things to find out what's right for your child. I'm working with the Rossignol Medical Center. So you can contact them for an appointment if you want to see myself or Dr. Rossignol or the other staff that we have. We have wonderful staff and we all kind of take the same approach. We work on, Dr. Rossignol and I have published many papers looking at what the evidence is. So
Mhm.
we use an evidence-based approach. So we then use the treatments we know that there's the most evidence and the things that are safe, of course. So we use science. We don't, just try and guess what the best treatment is. And then
Yes.
yeah, and then for other information about all the science and everything, you can go to our foundation. So we have the Autism Discovery and Treatment Foundation, which is simply autismdiscovery.org.
Okay.
We're also on Facebook. You can follow us on Facebook and TikTok. So, please follow, like, and share. And we have many videos both on Facebook. We try and put them on and TikTok, but also on our website. We have a whole catalog of different papers, parent papers, videos, and presentations that you can learn more about. So it's the Autism Discovery and Treatment Foundation, or Autism Discovery at Peer.org. As far as the folate and leucovorin
Mhm.
for Autism Awareness Month, we're releasing, my book is The Folate Fix, it's
Oh,
called.
awesome.
I think you can pre-order it on Amazon, but I think it should be coming out tomorrow or the next day.
That's
So
amazing. I can't wait to read that.
yeah, it has about a dozen stories from parents about their journey. And I think the stories will be very helpful to show parents that it's a journey. It's not just one thing, and people go through a lot to find the answers. So
Wow,
just
that's
keep moving
incredible.
forward.
I love hearing stories from other families that are a few years ahead of me. It just helps me hold on a little bit longer. So that book sounds amazing. Thank you so much. I really appreciate it. And I hope parents that listen to this learned something today and sparks them to try and do something different to help their kids.
My pleasure. Thanks so much for having me on.